What brought you here, Ellen?
I'm so sorry.
How long have you been coughing?
It's been 3 months already.
So it got worse recently.
Yes, doctor.
Do you notice some phlegm?
No,
Is the cough there all the time? Or it's on and off?
it's been here all the time.
Is there anything that makes your cough worse? Like positional changes, seasonal changes, after eating?
Positional changes like lying down makes me cough even worse.
Is there anything that makes your cough better? Have you taken any medication?
I took some cough medication.
So do you have any other symptoms besides a cough? Any fever? Chills? Night sweats?
I have had on and off fever.
Have you noticed any changes in your weight? Any changes in your appetite? Any changes in your bowel habits?
I have lost weight, though my appetite seemed normal and my bowel habits are regular.
Have you experienced shortness of breath? Have you felt any chest pain?
Yes, there were times when felt like I was catching my breath, and I also experienced chest pain sometimes.
Have you ever had wheezing? Headaches? Runny nose? Sore throat? Postnasal drip?
Yes, I have had postnasal drip.
Have you ever had asthma? Gastric acid problems? Allergic rhinitis? Drug allergies? Any heart problems?
No, I have not had any of those.
Do you have any other problems in your lungs? Stomach? Liver? Kidneys?
No, doctor.
Have you ever had any surgeries?
I never had one in my life.
Is there anybody in your family being sick now? What about at work?
Actually, I work at the day care center and the kids are always sick.
Do they have the same cough as you do? A cough without phlegm?
Some kids cough with phlegm, but some also have none.
Is there anybody who has had tuberculosis around you?
No, doctor.
Is there anybody in your family having other disease such as diabetes? Heart problems? High blood pressure?
My father has high blood pressure.
Now I would like to ask some personal questions which can be helpful for me to figure this out better. Is it okay with you?
No problem, doctor.
So how long have you worked in the daycare center?
About a year, doctor.
Do you drink? Do you smoke? Do you use any illegal drugs?
I drink occasionally, but I have not tried smoking and using illegal drugs.
Now, I would like to ask you about your sexual life. I know this is very private, but sometimes this can give us a big hint. Will you not mind?
Not at all. I am open for those questions as long as it can help figure out my problem.
Okay, are you sexually active? If so, how many partners do you have? Do you use protections?
No, doctor, I'm not sexually active.
Where are you originally from?
I'm from the Philippines.
Have you recently traveled? When is the last time you traveled outside of Los Angeles?
I went home to the Philippines 3 to 4 months ago.
Do you have any pets at home? Were you exposed to any animals or birds recently?
No,
Have you ever had PPD test? Like an injection on your arm and measure the round-in duration 2 days later.
not yet, doctor.
Okay, thank you for answering my questions, Miss Ellen. Even though there are some more possible sources of your coughs, like asthma or pneumonia, I'm still not sure exactly what it is. So I will run some tests such as blood works and chest x-rays. I think I can talk to you better about the diagnosis and the proper treatment when I get the result of those tests. In the meantime, I will give you medication to ease your cough. Do you have any questions?
I work at a day care center. Is this the reason why I have a cough?
It might.
Do I need antibiotics to get better?
Maybe. It depends on what you really have though. If it is pneumonia, they help. But for others, they do not.
Okay, doctor. Thank you so much for your time.
Welcome. See you soon.
Nice to see you today, James.
Hi, Dr. Klein. Nice to see you, too.
I'm glad to see you are staying on track with your checkups and cleanings every 6 months.
Yes, I know how important it is to come in here regularly. When I was younger, I used to skip checkups, and I had a lot of cavities and gum problems as a result. I can't get away with that now.
That's for sure. I'm glad that now you are nipping those problems in the bud. Let's see. When was the last time you had a set of X-rays done?
I think you took some X-rays during my last visit.
I'm checking your chart right now. Yes, you are absolutely right. Since you had X-rays done last time, we won't need to take any today. We only need to take X-rays once a year. So if you'll just open up nice and wide, we will start the cleaning.
How do my teeth look in general? Any problems?
Well, you have got a lot of plaque on the upper teeth. Also, it seems like your gums are bleeding a lot. Have you been flossing regularly?
I think so. I floss every night.
You might want to try a special electric toothbrush. That would help you reach difficult areas of your mouth more easily. You can find them pretty cheap at the pharmacy. They have come down in price. You can rinse your mouth with a little mouthwash now.
You know, Dr. Klein, I notice that I have a sharp pain in my teeth when I drink something cold or eat grapes from the refrigerator.
I'm not surprised to hear that, James. Your gums are receding, so your teeth are becoming more sensitive. Cold food and beverages will tend to be a little uncomfortable.
Is that something I have to live with for the rest of my life?
Unfortunately, yes. But there is a special toothpaste that we recommend, which can help to reduce that pain. I have some free samples I can give you today, and when those run out, you can buy the toothpaste at any pharmacy.
Is it sold over the counter?
Yes, it is. You don't need a prescription. It's just a little more expensive than regular toothpaste.
Do you see any cavities, doctor?
No, I don't. I'm happy about that. The only thing I do see is that this one filling looks very old and weak. We should keep an eye on it.
Why is that a problem, Dr. Klein?
Well, we want to make sure that the filling doesn't break apart. That would potentially expose the cavity again, which could lead to more serious problems.
If I notice anything unusual, I will be sure to let you know.
Other than the things I mentioned, I think you are doing fine. We are just about done. Remember, please, brush twice a day and floss every night.
Thanks, Dr. Klein. You really made my day when you told me that I don't have any cavities. There is nothing that makes me more nervous than that drill.
You won't have to worry about that for a while, James. You take care now. Don't forget to pick up your samples of toothpaste from Marcy on your way out. She will also set up your next appointment.
Okay, Dr. Klein. Bye. See you in 6 months.